It might sound a bit controversial, but I'm here to tell you that in as much as I'm not promoting promiscuity or anything, but we were discussing sex as one of the means for transmission of HIV. A lot of people have the misconception that once you have sex, unprotected sex, once with an HIV positive person, you're a goner, like you've got it. This is not always true. I mean, it could happen, but at the same time, you could also do it several times before you even contract anything. I mean, there have been practical examples. I've been inundated with requests for advice by people who inadvertently found out that their partners were positive and they've been having unprotected sex with them, and they eventually never really contracted it. But this is not to say that you cannot contract it once. So in all situations, you have to protect yourself and not succumb to high-risk behaviors. When it comes to the other means, blood transfusion, this has significantly reduced because of screening of blood donors. Although there's also that window phase where, because if somebody contracts HIV, that person becomes infectious, so it can infect somebody. But it takes about 2 to 12 weeks for that person to convert into what we call seropositivity. Like if you test for HIV, you find out that the person is HIV positive. It takes about 2 to 12 weeks. Like, that's why in high-risk behaviors, we have to test you until 3 months before we can say, okay, you're out of the woods. But within this period, somebody can infect another partner. So there's also that murky area whereby maybe if somebody is donating blood and then it's within the window phase, you might not be able to detect it, but there's a small subset of the population. So we move over to shared needles and intravenous drug abusers. Now, this is not a big issue in Nigeria, in particular, I believe the rest of Africa, because drug abuse is, it's permeating, but not in the IV drug abuse scenario. People might take tramadol and all that, but sniffing and other ways, smoking, sniffing, but generally people are afraid of needles over there. So, and then these needles are not available. So HIV transmission by shared needles is almost non-existent in my country. In conclusion, I want to mention something that I have not touched on, which is about healthcare workers. I'm appealing to healthcare workers in Nigeria and Africa not to be scared of HIV patients and to go ahead and provide them all their needs medically. Generally, contraction of HIV through needle sticks is rare. Research has shown that you will need to fill up a large bore needle with HIV positive blood and stick it to yourself, causing an enormous wound and drawing up enormous blood, like, blood to blood contact, maybe even almost up to 200 times before you even stand the risk of contracting it. I don't know what the practice is over there at this point in terms of post-exposure prophylaxis, but I know that here where I practice in the US, if you are exposed, needle stick and all that, you could take one of the several combos for HIV post-exposure prophylaxis for 1 month, and then that totally obliterates the likelihood of contracting it. Because of that, we do not practice in fear here. We take care of HIV positive and even AIDS patients without discrimination and without fear or favor, and treat them like any other class of patients. I'm hoping for a situation where this becomes the norm also in my country, and this is why I do some of these educational videos, to disabuse our minds about so much misconception about so many ailments. This topic of today centers around misconceptions about the transmission. I mean, there are other facets of HIV as a disease or a syndrome, like treatment, like prognosis, all that will come later in other videos. At the same time, when you listen to this video, when you watch this video, I don't want you to come away with the misimpression that, like, saying it's okay to take risky behaviors. No, prevention is still the best. But trying to teach you not to stigmatize, not to ostracize or alienate people that have it just because they have it, because they are not as virulent or infectious as we have been made to understand, either by omission or commission. So we love them, care for them, hug them, show them love, don't stigmatize. That is what this is all about. I hope I have been able to impact something into you that you didn't know, or maybe you had a tangential or sketchy knowledge about the issue before. Thank you. As I come back from my hiatus, and I do assure you that the frequency of these videos will not be periodic anymore, but more regular than it has been in the past few months. If you have not subscribed before, what are you waiting for? Go ahead, subscribe, hit the notification bell, share. This is how so many other people will get wind of what is going on and have life-saving measures at their fingertips. Thank you.